right, this is a special opioid crisis committee. This is Thursday, October 27, 2016. We're at 6 p.m. I have Councilor McKinnon.
Here.
I have Councilor Mangan.
Here.
And I have Councilor McLaughlin.
Here.
We have 3 members present. We do have a quorum.
Please stand to salute the flag. Before we start, I have one regret. It's Councilman DePiero. He had a prior commitment, cannot attend tonight. That was it. Please read the...
Right, the 2 agenda items. Item number 1 is creating an opioid response team. And item number 2 is setting up a program to do outreach in the community.
I have a correspondent from Catherine Rollins. She is unable to attend tonight, but has basically been working on a Waltham grant and looking into and doing research on the Waltham grant that's for Narcan, free Narcan, actually. And we've been looking into that. So it says, however, I cannot attend tonight's opioid subcommittee meeting tonight, unfortunately, due to a scheduled conflict. However, my updates include Narcan and Waltham. I called John Soupy on Tuesday and left a voicemail. Also tried again yesterday, but no response yet. We'll try again. It looks like he is in the Waltham Health Department, and his email address is online, so email may be easier. I'll also check with our health director to see if she also knows him and already knows him and what they are doing. New positions has not been filled yet. I am not certain if it will end up based in health, police, or fire department. That's yet to be determined. But it will work closely with all 3. Hope to have more information soon. The positions will be funded in part through the 5-year grant to be run through the health department, which requires positions working closely with CHA to also work in part on prevention and in part through city funds. Catherine Rollins. There's other invited guests that are not on the agenda, and I see them in the audience. So what I'd like to do is make a motion to invite...
Mr. Chairman, make a motion that we invite up Mr. Tim Spinney to appear before us this evening.
Motion made and seconded to invite Tim Spinney. I'd also like to have the fire department, Everett Fire, Chief Carley, and Captain O'Brien, I believe it is.
So moved, Mr. President.
Thank you. Second.
Please come up before us, gentlemen. State your names, titles, work locations.
Tim Spinney.
You got to turn that on, sir.
Tim Spinney, Albany Street, Everett, and I work for a private EMS company up in Lowell, Mass.
Anthony Carley, Chief of the Everett Fire Department.
Captain O'Brien, Everett Fire.
Thank you, gentlemen, for appearing tonight. Councilors? Okay. I have questions from the chair, so I'll be asking. Mr. Spinney, you come from the north section up in Lowell, EMS. I want a comparison. We did a comparison study. You brought in some facts and figures to that study on overdoses that are happening up in that area. Would you share those with us?
This is the most recent update. It's up to October 1st. Everything's all graphed out. And I was speaking to you, Willie, about that lull when all this, the heroin really hit. There was a small lull prior to that for about 2 or 3 weeks. And it was May 12th, I believe, or the 14th, that everything skyrocketed with the fentanyl and everything else. And everything is just pretty much like doubled and quadrupled. It's just insane. As of August, this year, there were 54 overdoses. And that's averaging, there's another page here that averages out, it's like 3 a day, 4 a day, that we're doing pretty much on an average up in Lowell, 3 or 4 a day. Yeah.
Now, Mr. Spinney, you respond through the EMS. Does fire and police also respond up there
Yeah,
as well?
it's a multi-agency, the police, fire, EMS, and the medics go.
Okay. Now, do they carry Narcan on the fire and the police?
Yes, they do,
vehicles?
and the police just started carrying it, I don't think, like 6 months ago, 7 months ago. So
Have you seen
everybody's
that-
got the Narcan.
Have you seen an increase or a decrease in the saving of people from that?
Oh, yeah, it's like twofold. But the amount of Narcan that we're using now, it's like doubling. Sometimes you're using 2, 3 of them sometimes.
And why is that now? Because the potency?
I believe it's between the fentanyl and everything else that they're cutting it with. And they don't know what they're getting, and they don't know how much they're taking, and everybody's different. So if they used to take this much, and they still take that much, it's cut with 2 or 3 other substances, it's just knocking them down.
Now, there's a new drug that's going to be hitting the market soon that they were talking about. It's coming in from
That's-
China.
Yeah, it's called cafentanil. I believe it's an elephant tranquilizer. And I was online looking at it, and it's 100 times more potent than fentanyl. It's 80 times more powerful than morphine and 50 times more powerful than heroin.
Now, was there a reported case in Maine?
Yeah, I was reading out online, I was up in New York, Maine. It's the first one here, I guess, in New England.
So
that
it's
they had.
already here?
Yeah.
Okay.
And from when I read through the news reports and stuff, they'd taken 7 rounds of Narcan.
7 rounds? Injectables or the nasal, or both?
Nasal, I believe. Everybody's using the nasal. And it's like 2 milligrams, so you're actually up to like 14 milligrams of Narcan.
That's just to bring them back with this
Yeah.
on board? Okay. Now, so this is definitely here then, so that reported case is
It's
true.
pretty much, the majority right now is like the Midwest Ohio and stuff like that, and there's some in Florida, Virginia.
But it's trickling this way?
Yeah.
So I'm assuming that we're gonna be seeing more cases of that. All right, thank you for that. Councilman Mangan?
Thank you, Mr. Chairman. Thank you, Mr. Spinney, for appearing, and members of the fire department. Thank you, Chief. Tim, up in Lowell, I know you've been up there for a while, up and working up in that area. Do you see it, the use of a lot of the overdoses, is it in a certain area of Lowell, or is it, is it widespread throughout the city? And the other thing, because you respond to a lot of these, do you see a lot of the same individuals, or is it, this happens to be separate people all the time, you know?
For one, it's pretty much citywide, but the majority of it, the way the city's broken up, it's more or less like the downtown area and the acre section. That's the way the city's divided. And I'd have to say like 80% of these people are all repeat users. We'll do them a couple times a week. It's just there. They have like easy access to it, and we bring them back and they're like, we didn't do it. And we tell them that Narcan tells us otherwise because it's the only thing Narcan works on. And then they kind of agree to it, and
So do you know if there's a lot of the individuals that, that have overdosed and Narcan has, brought them back? Do you know if there's a certain amount of repeat offenders, like people that have, it's happened to them multiple times, or once it happens, they kind of, not do it again? Do you see any repeat offenders that the people repeat, that you have to go to, or do you know through the fire, the police department, where it's happened to, like, maybe more than once?
oh yeah, we pick up the same people pretty much all the time.
okay.
Once there's always like a lull. It comes, you know it's there because everybody starts overdosing, and then it kind of trails off, and then it picks up again. And when it picks up again, you're continually picking up the same people. And it's a sad thing. It's always the same people, one after another, every day.
And I don't know how often you're able to talk with these individuals, but do you see, like, wouldn't you think that, once almost, dying from it, that people would kind of, like, think that, geez, I want to go this route again, or are going to be a little bit more cautious, but it evidently just doesn't seem to
I
faze
think
them.
it's more individual aspect of it. They're addicted to it, and it's that high or that they call it like an euphoria that they
Yeah,
crave from
euphoria.
it. And I think that's what just keeps getting them to go back to it.
Okay. Thank you, Mr. Chairman.
Thank you. Councilman McLaughlin, any questions on that? Okay, thank you. Chief, do you have results from this past 14 days that we took a look at, we're doing a study on now here? And either or you yourself or the captain?
Yes, we brought some information up. We actually ran a little bit further back. We can talk about the last 14 days, because we've seen an uptick over the past 2 weekends with some overdoses.
Sure.
We're also working to change our tracking of overdoses. We have a special code that we've been using for the past about 2 years on Narcan, administering Narcan, so we can track that. But we're also noticing an uptick where we're responding to overdoses, but not necessarily using Narcan, so we want to track those calls as well. So we're working at assigning a new code to that. But Captain O'Brien can elaborate on what we've dealt with, and even within the past 48 hours, I would say we had 3 with 1 fatality. So,
3 with 1?
Yeah.
Thank you. Captain?
So, our experience has been, you're actually right, Mr. Spinney, it wavers. We can actually track when a bad batch or a poorly cut batch of heroines come to the street, because we'll have an uptick in number of incidents. And up until real recently, it was corresponding with fatalities also. I did run the month of September. For Everett, we used Narcan 11 times. That doesn't mean we had 11 overdoses. That means that we got there and administered Narcan 11 times. That's the reason we're changing our coding protocols, is because we want to capture all the overdoses. The other thing we're looking at right now is DPH has just allowed the protocols to expand to use what's considered a single-stage dose of Narcan. These single-stage doses, you don't have to put it together, it comes together in a package. And it's double the dose that we're using right now. And that would sort of answer the question about if we're getting more potent heroin in the street and we're using up to 7 doses on a single patient, we now start with 4 milligrams rather than 2, and we're ahead of the game. So we hope to make that switch real soon.
Now, what's the cost on that right now?
So right now, the single dose 2 milligram multi-stage atomizer nasal Narcan costs us about $40 for a single dose.
That's for nasal?
That's for nasal.
Okay.
The single stage will cost about $75 dose.
Now, that's the injectable?
No, it's still atomized
That's still,
nasal.
okay, so that's
But
still
it's,
staying with the
we don't
nasal.
have to put it together, it's one unit.
Do you have nasal as well that you carry on the
Yep,
vehicles?
that's what we'll
Okay.
carry. We've been carrying it
And then
since
you,
2014.
what about the injectables?
We no longer carry the injectables.
So you just, okay,
So we were part of a pilot program in 2014 where we had auto injectors. It was much like an EpiPen.
was that
Yeah.
through a grant?
Yes, it was. DPH, the Department of Public Health, had that grant. And they were very successful. We loved them, actually. If you can love a medicine that stops somebody from overdosing.
Sure.
But the thing about it was it wasn't sustainable. We were paying, if we were to pay for those units, it was somewhere in the neighborhood of $580 for 2 doses.
Okay,
Yeah, it just, you couldn't do that.
so that would eat up the grant
Right.
right away?
Right,
Okay.
real quick.
I know that, and we're looking at right now what they're doing up in Waltham, and John Soupy, the health director there. I know that I had conversation with him, and my conversation with him was, he was saying basically that he goes to the hospitals in the area, and they have federal funding through grants that they receive for community. And when they have the federal funding for grants that they receive through the community, they have 100 units that come out monthly to the fire department or police department. So that's what they're getting now. So that's what I'm trying to bring here for free. And any leftovers that they do have, if someone was to come in, and say my child, my husband, my wife, whoever it may be, has a problem, then they give them a voucher that they can actually go and receive it. So if they're not utilizing that and they're in the swap over period, they give them the voucher as well. So that's what we're trying to do here now. So if we can do that, we'll save you some money. Now, Mr. Spinney, do they actually have this up in Lowell as well as the police and fire? You said, yeah, Narcan.
Yeah.
Okay. Now, how do they get that? Do they have to pay or purchase for it as well?
I don't know how the police and fire guy,
Okay.
I'm not familiar how the police and fire department.
All right.
How they pay the knock-in.
What do you guys pay on the EMS side?
Excuse me?
What do you guys pay? Do you know the purchase price on
I
it?
think it's like 40, 50 bucks a thing.
Okay.
For the,
So it's similar to what we're doing here? All right. All right. Councilman Mangan.
Thank you, Mr. Chairman. Chief or Captain, if you can answer this, I know you just said recently you had a few, 3 or 4, you had to use it, and then, you had one fatality. Because you're not, overly experienced with Narcan, but basically, when you show up and a Narcan is given to the individual, I mean, is there a chance that it's not gonna do anything? Does it always save the person's life, the person that did, passed away, was it Narcan administered and it just had no effect, it was too far gone,
In the case of the fatality we had in the past couple days, I believe that by the time we're notified, we couldn't have brought anything into that room to help
Okay.
save the person.
Individual. Okay.
Exactly. What happens at several stages during an overdose, obviously you want to get there as soon as possible because labored breathing, their body is starting to shut down. So Narcan is going to help as early as possible. You see a lot of recovery centers as it's become more common as far as being close to, being able to pick it up at a pharmacy. Families that battle addiction are able to now have it. There's a reason for that because it's like any medication. The faster we get it to the person, the better it's going to be. The unfortunate side of this addiction is a lot of times the people that are with these people that are overdosing don't want the authorities there. So by the time they realize somebody needs some help, these people are really in the throes of an addiction, and everybody is usually in that room is in that same boat. So by the time we're getting the call in some cases, it is unfortunately too late. I think the police and the fire, and I know for a fact in the city, we work very close. We're not there to judge people. We're not there. I know the police aren't there to just
No, you're
arrest
here to
people.
help.
We're here to help them, and we let them know that too. And
Right.
I think in many cases they do know that, but sometimes it doesn't always work out the way we want to see it. Like Mr. Spinney, we do have people that, I can ask my company officers, I can ask the people that ride the apparatus, that they know when they hear an address coming through that that's what they're going there for. That being said, I think because we're a smaller community, we're able to treat these people with care and try to get them the help that they need, but the unfortunate side is these people don't have a choice once they're in the throes of this addiction. I don't think anybody is choosing to almost die on a daily basis and to have the fire department show up. So anything we can do to help this, but I never want it to become an economical thing. We had, like the captain said, we had great success with the auto injectors. And the reason why we had great success with those is because it was a cleaner dose, it's a faster acting dose, but the truth of the matter is it's $500, and the numbers that we did, or the numbers that Mr. Spinney did, that would eat up a lot of the budget. So we're trying to, the one-piece auto injector or the nasal, the one-piece nasal that we're looking at.
Excuse
going
me,
with-
Chief, is your mic on?
It is.
Okay, thank you.
The one-piece nasal injector that or the one-piece nasal program that we're looking at going to, I think will get almost close to the same benefits we had with that auto injector without breaking the bank, so to speak.
And you see it to be almost as effective, you believe, and also cost-wise, with comparison to what, the $40 or $50?
We could swallow from $40 to $50 up to $75. We could swallow $40 to $50 to $500. We just couldn't. We hope that we haven't used them yet. We hope that they'll be as successful as the auto injector.
Yeah, and I understand it's funding and everything else, but at the end of the day, just personally, I can't speak for any other councils but myself, but certainly going forward, Chief, Captain, you come with, front of us with good raw numbers and stuff, and we want to try to get you the best. It's just like equipment and everything else out there, and certainly, I don't wanna be cheap on anything or go the wrong route or so forth, so just personally me, I feel like if, whether it's, you know, $10,000 or $50,000 or 100 or something like that, I just think that having the best thing available, in my personal opinion, is well worth it, and to have it, you know, for our first responders to administer, I think is so important, so, like I said, speaking for me, just going forward, if it's a budgetary thing, certainly, you know, I'm all for, appropriating certainly additional funds for, you know, to make it, you know, to make it run better, so just, you know, going forward, so.
Well, I
just,
appreciate
you know,
that,
just so you
Counselor.
know that.
And the council has always been supportive of the fire department, giving us everything we need. And that is part of our new tracking system for the overdoses, because we want to get you guys some good numbers. We want to, you know, and see how we can best help this. We're also talking about prevention, you know, working with the schools, working in early intervention with these people and getting with it and through this program. And I think those go hand in hand. We're always going to be there to respond to help these people after the addiction has started, but we really want to get out in front with the prevention programs.
All right, great. And the other thing too is I know we're in the process of hiring a clinician, and I don't know whether you or the captain or Mr. Spinney has any recommendations. I mean, again, for funding purposes, I want to be able to combat this in the best way possible. If you either want to use, beyond having a clinician, would you recommend, I know it costs money, but anything else that you believe that we should be doing here in the city, you know, additional to what we have now to, you know, combat it at its best? Any, in terms of another position, or what you may see in other cities or towns and stuff like that, that may be helpful to us?
Well, on a national level, the research I've done, I think a lot of cities are starting to take the approach of similar to back in the 70s and 80s with the Fire Safe program, at least from the fire department side of things. They saw an uptick with juvenile fire setting, and they realized the earlier we got to children and started explaining the dangers of that, we did see on a national level those fires start to decrease. And I've seen some talk, not a huge amount up in the Northeast yet, but getting into these schools and starting to talk with an actual curriculum. You know, what age is appropriate remains to be seen in some areas, but other areas is to start talking about this. These kids are seeing this, right? Just like they saw smoking fires, just like they saw matches lying around. These kids are growing up in homes where addiction is very present. It's not in the alleyways. It's not homeless people all the time. It's family, it's workers. We know the trail of the prescription, how these addictions start a lot of times, with a legitimate injury, you know, they're prescribed pain medication, and then they go down this path. These are family people, brothers, sisters, mothers, daughters. So I think if we get into the schools and we start as early as possible with this, we might be able to do something. That's what the captain and I have talked a lot about that.
Now, let's just say that going forward in the very near future, you were able to come up with the work on something with you know, through the administration and the, you know, the superintendent in his office, which I'm sure they would greatly
He's always
appreciate
very
it.
supportive of those types of
Would
things.
would you need any more personnel, like a specific person, like an additional person to the force, to your department, to, you know, maybe to do this on a full-time basis, or do you think it's something that's not needed on a full-time, so?
Well, I think the city as a whole is taking a step in the right direction with looking at that position to kind of spearhead this. I think I can speak for the chief of police. We'd be willing to help out any way we can. And if the program grew, to have somebody dedicated on police and fire to work with them. But I think we're making the right steps by having somebody dedicated to start off, the clinician, and then maybe help guide us. And, you know, as always, you know, my guys in fire prevention are willing to help where they can, but they're overstressed. But I think having somebody as a point person to start this program and then developing that program with the support of the school, which I fully anticipate to get them in there and kind of guide us, but I think maybe a year, 2 years down the road, yeah, we'd be looking at dedicating personnel.
Okay, well, that's great. And the last thing I have is, as I asked Mr. Spinney up in Lowell, in the particular areas of Everett, have you seen it to any certain areas, or certain streets or neighborhoods, or is it just kind of random throughout the whole city?
You know, that's hard to say. We talked about this at the last task force meeting about the opioid problem. And, Years ago, it used to be along the stretch of like Route 16 and, different areas. But truth be told, we're going into neighborhoods you'd probably never imagined in Everett in combating this. No one's safe. And, I mean, we can do we're talking now about mapping some certain calls that we're doing. We could probably try to do some research and see. But I could be honest with you, without even looking at that research, I can tell you no one's scared. From our Ferry Street station, our Hancock, our Central, they're probably well spread out on
Okay.
what we
All right.
respond to.
Thank you very much.
No
Thank you,
problem.
Mr. Chairman.
Councilman McLaughlin? Go ahead, Mr. Spinney. Hold on one second, Mike.
Are you asking about like
Yeah.
different programs that are intervened with the people? Beginning of the summer, because a lot of the households we go in, like he was just saying, that you don't know where you're going, it's not who you always think it is. A lot of these houses that we go in, you have kids, and it was DCF or DSS, whatever you want to call it now, they keep changing their name. They implemented, if we go into a house and we see anything that has like toys or kids' drawings or books or anything, they gave us a number to call, and we give them the address, and they do a follow-up like the next day.
Who is that?
It's-
Who's doing the follow-up?
DCF,
DCF,
Department of
okay.
Children and Families
Yeah.
Service. We call them, and they basically go in as, just do like a welfare thing to see how the kids are doing and stuff, or see if the kids live there, so.
We participate in the.
I
same
haven't
program.
personally used it, but I know quite a few of the crews have used it, and they've called them in.
We've actually had some pretty interesting saves because of that. And it was something as simple as
Just from what you're seeing out in the field?
yeah, a company officer goes into a call, they're making up, they're leaving the scene after the patient's being transported, and realize there's kids, or kids should be here because of the toys or,
Sure.
bedding or things like that. And then that's enough of a red flag that the Department of Children's Services will get involved in it. So, and.
Who makes that call? You guys?
Company officer.
Okay.
Yeah,
So
we're
the office in charge.
mandated reporters, and that would fall into that category.
Councilman McLaughlin?
Thank you, Mr. Chairman. Through you to Chief or to Captain. In the past 2 weeks, can you roughly guess on the amount of overdoses that we've got in the city? And I know you said there was a recent one in the last couple of days of fatality. Is that including the one that happened over the weekend? Is that the same one that happened over the weekend, or an additional one? Do you know, Chief? Do you have the-
So over the last,
So right there, looks like it starts right 10. If you go back to that one over here, 10-8. So again, we could give you the numbers on the Narcan that we've issued over the past 2 weeks.
And this is not with the new program, Chief?
No,
Okay,
we-
the
we
new
just-
program.
Literally, we just instituted that this week, so.
All right, so we'll have that later on.
Next time.
Okay.
They come up.
Thank you.
so over the last, since the 8th, we've had 9 overdoses where we administered Narcan. Now, we could have had 9 more overdoses where we didn't give the medication. But what I have here is where we administered Narcan.
Cap, what makes the decision of administering Narcan or not administering Narcan on an overdose call?
Really, it's about response. So if Cataldo, who is our EMS provider, gets on the scene at the same time, particularly if they're paramedics, they'll take over medical care, and we play a support role. We give Narcan if we're first on scene and treatment calls for it.
Okay, so it's just a matter of who gets there first.
Right.
Is the lead on
Exactly.
issuing Narcan dosage. There's been one fatality in the past 2 weeks. Is that correct?
It was over the weekend.
Over the weekend was one.
Unfortunately. Okay. I'll yield the floor to my colleagues at this moment.
Thank you. Let's see here. I just want to clean up a little bit of the conversation that we've been having. As far as the school, what level they should be at, it's grade level 3. I've been in talks already. We've been in talks, the whole committee's been with the school committee. We're looking at probably grade level 3. We have funding right now we're waiting on. We're anticipating that it will not be cut, so we're hoping that it will not be cut. But I spoke to Representative McGonigal today, and he said that he would like to hold it over till November to get the funding for the position that we're going to be introducing to the school. That's going to be a health type scenario health teacher to that effect. And what they do is they'll go into the school with curriculum and they'll start teaching grade level 3 up to grade level 11. So we'll have that covered, pretty much. But, Chief, what I wanted to run by you was, the next item was setting up programs to do outreach in the community. I know there's different fire groups, like, I think it's Chelsea, Revere, they have different individuals that go around, and once they have an overdose that happens, they go right to the family's door, basically, and they knock on the door and they give them information regarding beds, regarding, the overdose itself, regarding that. That's where the clinician's gonna probably fall into effect. And we were looking, because Wakefield does it with the police, we were looking at which way to go, because we have the personnel director in the back, and that was one of the questions that we were gonna be coming at you with anyway. So that was a good question. Thank you, Councilman, for that. But that's what we're looking at, where we're gonna house the clinician. Because if you're having possible 18 overdoses within a 2-week period, we need someone to actually be going out there that has the medical background as a clinician would, or a social background as a clinician would, and then go along with you gentlemen to actually, see the administration of Narcan, then go along and go forward if they make it out of the ER, to get them help, treatment, beds, and then the family follow-up afterwards, which will include the children and everything else. So they're going to be a very vital tool here. Wakefield, the chief out there, Chief Rick Smith, I talked to him. He was on a task force that I was on. He basically said, we had it for 7 years. It's been a blessing for 7 years. He can't say enough about it. So I look forward to having more dialogue on this. Councilman McLaughlin? Yeah, bring it in now, because I'm going to bring up the rest of these people. I want them to come up and testify as well. So you could talk now on it if you'd like.
I would. That's fine. I wasn't sure if we were taking one by item 1 and 2. I apologize.
We read them both.
Sorry about that. Mr. Chairman, through to you. I understand the need of having a team of response to go out there after an overdose, after an issue. But I think this problem goes much greater and much stronger to the root. I had an issue with a resident. She had found somebody that had overdosed in her neighborhood in front of her house, right? So a medical call comes in, they take the person to the hospital. 5 or 6 hours later, person's released, they come back and they get their car out of this individual's home. Talking with first responders, they said, what happens once this person goes to the hospital? Nothing. They don't notify the family, they don't notify anybody. You walk away from the hospital, you go back
Counselor,
and you take car.
excuse me for a minute. On that note, I've read certain individuals that have come out of the ER that basically they said, you died today, go seek help. So.
And again, exactly, and the chief just stated, and I'm not going to put words in his mouth, but these people are not the most open to having this dialogue when they're in or in the middle of that crisis in their life, right? They're not thinking straight. They're not in, the right state of mind. They're not willing to have that conversation. So I think to have that individual is helpful, but I think there's much more to that subject that needs to come out in the open, because I'm not sure that individual is really going to see a lot of success if the people that are having the overdoses aren't willing to come to the table and have the discussion and start to want to discuss it. It's great to have somebody there that can discuss it with them, but you need to want to do that.
They can give the family members the information that they need.
But if the family members aren't being notified by the hospital or whomever, they have no idea that their loved one just had an overdose.
This is how it works in Wakefield. As soon as there's an overdose that happens, the clinician will go out and they respond with police and or fire. And at that point, that's when they take over. They go to the family and they actually report what's been
But
happening.
isn't that a clear violation of HIPAA laws? So if the medical field can't notify somebody that's over 21, this individual can supersede the HIPAA laws and be able to do that?
That's a good question.
So it's a very gray area,
Oh, yeah,
right? And I
it
think
is.
it's something
But
that
it,
needs to be
at the
discussed.
at the same token, it's been working for 7 years in Wakefield. So,
And I'm gonna research Wakefield and.
oh yeah, I would.
You know, a friend of mine's
Definitely.
selecting up there and talk to him about this because,
The second part of this, though, is there's 2 positions that we're looking at hiring, I believe, and I'll leave this up to the personnel director. But one is a program director, which we got a $450,000 grant for. That was supposed to be put up. We just got a green light, and I'll let him speak on it because he's been sitting here waiting to speak on it. Sorry about that, I apologize. But there's 2 positions going up. One's the clinician, and then one's the program director.
no,
So,
I'm 100%.
From our health the
I'm
health
100%
department.
on board for both of them, but I
Sure.
think the program director's position needs to have a lot more dialogue and a lot more direction of the duties and responsibilities and the hopes of that individual than the clinician.
We'll speak on that when the personnel director gets up, because we'll have more, you know, of what we're going to be looking for in each position. Any other questions on? Motion made to excuse the customary thanks. Thank you for appearing tonight, gentlemen. Thank you for the stats, and Chief, we'll be in conversation. Thank you, Mr. Spinney. Thank you, Mr. O'Brien. I'd like to actually recognize individuals that are sitting in from Malden. We have Catherine Brandano, Catherine Bordenaro. I'm sorry. I said it too many times last night at Senator DiDomenico's from Malden School Committee. Right now, I'd like to actually have some of the program people come up. If we could have Everett Overcoming, Miss Jean Grenick from CHA, and also you can come up as well and just come up and observe, and if you have, as well. Just state your names, titles. Everett Overcoming. Before we do that, I'd like to have the personnel director, you come up, but I'd like to have the personnel director come up as well so we can move it along. Mike. If you could just state your name and title, please.
Good evening, Michael Vitrano, HR Director.
Thank you.
Patty Scalise, Everett Overcoming Addiction.
Hi, Jean Granick, Cambridge Health Alliance.
Hi, Jean.
And the Everett Community Health Partnership.
Paul Hammersley, President, Malden Overcoming Addiction, and I work for the City of Malden as well.
Good evening. Catherine Bordenaro, member of Malden School Committee.
We'll start with the personnel director. If you could just elaborate on the 2 positions that we're looking at filling, and just a time frame on them.
Absolutely. We'll be posting a clinician position, a full-time position, this week coming up, and also the program coordinator out of the health department. It's a 30-hour-a-week position, and we'll post that, we'll source the applicants and get them hired on board as soon as possible. There's some requirements to meet with the program coordinator, and there's a minimum requirement of a bachelor degree in public health or social work nursing. And they should go up on the City of Everett website and the MMA website here by Monday, the latest.
Thank you. Questions? Councilman Mangan.
Yes, thank you, Mr. Vitrano, Ms. Grant, anybody that can answer this. In terms of, we talked about some of the things that a clinician, you know, the previous speakers before you, what their, you know, possibly responsibilities. If you come up with a clear cut, what exactly they're gonna be responsible for and what their duties are, so, you know, that they know exactly what they're doing and, you know, how to do it and so forth. Because I don't know if cities and towns may do it differently, but for Everett, do we have a clear guidelines, you know, what they're gonna be doing exactly, do you know? Anyone that wants to
So I can add that my intention is to sit again with Elaine Silver, the head nursing supervisor, and some of the other resources, and put the job description together that's going to be for the specific roles and responsibilities. I just learned this evening that it's already in place for 7 years in Wakefield, so that would probably be a great place to start, as Councilman McLaughlin had mentioned, maybe doing some research on that. So that's what I'll do over the weekend, personally do my due diligence before I sit with Ms. Silver on Monday and some of the other resources.
Okay, do you want to add to
So
that?
if, I may not have all of the pieces of the puzzle together, but, the grant that the city of Everett received, this past year, a strategic plan was written, which actually,
Did you write that?
Yes. I wrote
Okay,
it.
thank you.
And the strategic plan had to be approved by DPH because they had specific strategies that they were willing to fund. And so that was submitted in August, and it was approved in September. And we have had one planning meeting to roll that out, and this position, my understanding is this person will be the coordinator of the strategic, of the strategies that DPH approved. And those strategies reach children and parents, high school
Okay.
age and parents.
All right, excellent. And Mr. Vetrano, do we have a time frame on when, I mean, we're looking at a month, 2 months, when we actually would like to bring this person on? Whoever gets hired, the individual?
My goal is always right away. It all depends on the amount of applicants we get and the quality of the applicants. It becomes challenging with the residency requirement. So there's a few hurdles, but once we get the pool of applicants, we'll close the job posting, review them, and hopefully we have a candidate that's local and qualified.
Okay.
Can I also
Sure.
add? So there are many other neighboring communities that also have this Department of Public Health funding, and they have job descriptions as well. So Malden has one.
What cities?
Malden, Medford. There were something like 16, at least 16 communities across the state.
Just so he has them, so he could check into
Yeah,
it.
I can forward you the list. of
Sure.
all the-
Excellent.
And for what it's worth, all the people who are involved in this grant, that statewide, there's technical assistance and very helpful guidance throughout the process, because DPH wants the funds to be spent in a way that has shown that there's evidence that these strategies are successful.
Okay. And to our, thank you for that, and for our guest from Malden, any insight you could add to us? I know she said you have something over in Malden, but anything you could add, things that you see? I mean, I'm sure a lot of the same problems in Malden you see in Everett, but anything you would recommend, or anything that you could give us input on?
Sir, can we have your name one more time?
Paul Hammersley.
Paul Hammersley?
Yeah.
We just need it for the record.
Yeah, no worries. Clarification, first off, what exactly is your clinician going to do? And then I can give you a little bit more information. As far as I see, clinicians usually go out with the officer, is that correct? Because the percentage on arrests are so high, it's like at 70 or 80% that could be mental illness or addiction related, and the clinician that they could call could bring the arrest rate down a little bit and maybe diffuse the situation. Is that what I'm understanding? Okay, the piece I haven't heard, I heard a ton of good stuff, but what we're trying to implement in Malden that is huge with this, and I've learned it from Winthrop and Arlington, is the recovery coach piece. So 5 of us in Malden have went, and we've got our certificate, I'm one of them, to be a recovery coach, so we have 5 people. So what the recovery coach does, now here's the piece that you guys were talking about. The person has to want it. They have to ask for it. So after the Narcan reversal, we met this week, myself, the mayor of Malden, the police chief, the fire chief, and Cataldo. So we're trying to implement this program. And I'm very gung-ho with it, but they kind of gave me the statistics, and so I need to do a little more research. So the program we're trying to do, so that we had, I heard your overdose rate the past 2 weeks. We've had 8. We've had 6 and then 2 last week, none fatal. But we've had 8 in the past 2 weeks. All Narcan was used. So what they've explained to me, the fire chief and the police chief, they go, they do their thing, and they can go so far. And it's just like it's a big circle. They go out, it's a lot of the same people, and they go in, they bring them back, and they end up leaving. That's as far as they can go with it. What the recovery coach could do is go to the next level. So what we've been trained to do is take that person to help. We know where all the beds are. We know where all the aftercare is. We know, like, if you need you have to want it, okay? And I think it's 48 hours, the person gets revisited, potentially after a Narcan reversal. They get contacted after the reversal and asked, are you okay? Do you need help? Now, if the person says yes, that's when we'd like our card handed out, and we meet with you weekly for an hour. We just meet you where you're at. If you're using, if you're clean, it doesn't matter. We'll meet with you, because if the person's reaching out, they're looking for further assistance.
Excuse me, Paul.
Go ahead.
On the first initial contact with them, how do you do that? Do you call or do you
With
go?
who?
The overdose victim.
Okay, so what we're trying to put in place, what I'm envisioning, okay, is after the Narcan reversal and they visit the person that's been reversed within 48
Physically,
hours.
They physically visit them?
They physically visit them, call them, or there's a contact made somewhere. Would you like help? If the person has to say yes. If they don't want the help, it does, it's not going to go anywhere. But the second they say yes, if they know something's available, look, we have these people, there's a recovery coach, why don't you just meet with them? And our police chief is on board, because he could say, here's a lifeline, this can save your life. So, and I was very gung-ho with it. The 5 of us were ready to implement the program, so then he kind of put it into perspective where I understood, and this is where I'm glad that I'm here. I would like to partner with Everett, with Revere, with Medford, and I'm going to throw something out there to you guys. It's a little bit of money to send people away to become a recovery coach. It's a 5-day program. Now, there's 2 ways to do it. You can be certified where you do not get paid, like myself. I'm not in it for the money. I'm in it just to be able to go visit the person and coach them back in. I'm also a 13-year opioid survivor. So I wanted to put that out there too. I'm in recovery. So now, the other part is being licensed. If you get licensed, it takes about 18 months to do it, and then you can be paid. You get on a list with hospitals, and they call you, and you'll be utilized a lot more. But for purposes of what we were trying to do right now, because let's face it, we're in it. We're in the trenches. We gotta do something. So a recovery coach can talk with that person, get that person treatment, get that person a job, whatever it is they need, and when you meet with them weekly. But now, like the police chief said, okay, Paul, let's just break it down. So I'm meeting these people every day. I'm seeing sometimes 10 a day. You mean to tell me you're gonna have someone, they want a list, and we have to do it right. We have to provide a list. Who's on call, what day, and 24 hours in a day, 168 hours in a week, Monday to Sunday. We need to provide them a list. On Monday from 12 to 3, it's John. It's from 3 to 6, it's Steve. So when that phone rings, you know when you're on call as a recovery coach. You might not get called, but you might get called, and you need to show up. So I had to back off a little bit because we only have 5 people, and we don't want this to implode before we launch it. So my thinking is, if I can get on board with Everett and Medford, we get recovery coaches all in the same, like, get 40 or 50 of us. Whether it's Everett that calls, Malden, because we use Cataldo as well, and we're looking for Cataldo to give that ride to treatment. That's the other thing I'm trying to pull into this, because when New Hampshire has the safe house, and this is what we're trying to implement. The Malden Fire is willing. They're talking with us as far as having addicts go turn themselves in. Every firehouse in the city. You can walk in, there'll be a firefighter on board to take your vitals and call Cataldo. Cataldo will come in, and then the recovery coach could come in, because if you walk in for help, you're right away, you're admitting you want help. So now the recovery coach is going to be used in that situation. And I think New Hampshire, they implemented it in, my numbers aren't 100%, but they're pretty close. They implemented it in March, and they've helped over 400 addicts that have turned themselves in. Okay, so Malden is on board with that, but before we go ahead and try to do that, we have to make sure the recovery coach piece is in play. We only have 5 people. So I'm thinking we need about 40. And then if we can get with other towns, because face it, we're all in this together. Like, this isn't a Malden and Everett and Medford thing. This is an us thing. Like, people are dying every day at an alarming rate, and we need to do something. So that's what we were trying to do in Malden. That's one of the things we're trying to implement, and everyone's on board. The missing piece is the number of recovery coaches. And then we could sit down and say, okay, this is the 168 hours in a week. These are the people on call, and you hand this list to the officer and the fire department, so when they go out and do their thing, they can just drop this piece of paper and say, here's a lifeline. If you want it, use it. This is your lifeline. These hours, these times, these people are here for you, whatever you need. And so like Patty, we're posting every day where the beds are. We are letting people know where the help is. But again, it needs a little bit further, and I love what you guys are doing. The other piece, we went to a fentanyl summit with Senator Markey a few months back. And I hate to say it, this is going to be a generational thing from what we learned. They said we're looking at 2 generations before this gets better. They said Godzilla's not even here yet, and as you heard with the fentanyl, it's making its way down 95 as we speak. Okay, so this issue is going to get way worse before it gets better, and that's what the prediction was from the people in the summit. So we have to do things like this to try to implement a program, and I think the recovery coach piece could be a huge help. I don't see many people doing it yet. Arlington's doing it. It's been successful.
Who else?
I've seen Arlington do it in Winthrop. I went to the Winthrop meeting. Winthrop has that going on, and I talked to the chief. Malden, we're trying to put it in now.
Okay.
We have the recovery coaches on board. We just don't have enough. So it was like $600 for the 5 days, and Medford actually paid for Malden to go, because we are about 2 months away from being a nonprofit. So it's all in the works now, so we didn't have the money. Medford sent us, Medford Mystic Valley Public Health Coalition. So we have 5 people on board ready to go. It was in Worcester. You go for 5 days, you come home with a certificate, and you are a certified recovery coach. So I strongly recommend that you try to get some people that might be interested in doing this work. It's total volunteer.
How do you, Paul, how do you find the, like the individuals, now someone like yourself, you know, but like, let's say there are people, which I'm certainly positive there's a bunch in the city of Everett would be willing to do this. How do you, like, you know, how do you find these people? I mean, do you advertise it in the papers? I mean,
It's online. What I've done, we started Malden Overcoming Addiction about 1.5 years ago, and I've got about 40 members, and we're committed. We are just a grassroots coalition with no money, and we are just, the first year was the awareness phase. We have touched thousands of people with the campaigns that we've done. You can just go on our Facebook page and look, but online has been super powerful, and our mayor, police chief, and fire chief have backed. We've been blessed because everyone's on board with what we're doing, so the whole city knows that we're here, and I'm going out like daily, and I'm just spreading the word, and we're up to about 40 members, and everyone that's coming is all there for the same thing. It's everyone's believing in what we're doing.
Now, where do they actually go for the, to become certified for the program?
We went to Worcester State College, but there's other places that you can go. We went to Worcester State College, and you see it advertised all the time. I'm always dropping the links out. There was another link that came out today. I don't have the information where it was, but they're constantly having these programs. Recovery coach training. Recovery coach training, and then once you do that, there's all kinds of other levels that come with it, but just it's the 35 hours you need to become certified. You have to go and get the 35 hours in to become certified so you can deal with someone one-on-one.
Now, again, as I said to the chief earlier, because I'm all for, as you said, it's probably going to get worse before it gets better, and I'm all for combating this, and certainly as a member of the city council, you know, funding, you know, individuals to go do this if it's needed, unless there's grant money available. But would you recommend then that we have people, you know, part-time, like on staff for the city, for instance, part-time, and pay them some type of stipend to, you know, in order to do this? Do you think or do you think it's strictly, it should just be a volunteer?
I think this should be a volunteer thing, and I think the second that you do this right and you put it on your website, on the city site, and you just, however you do it, you know, recovery coaches need, would you like to help? Call for a meeting. Anyone in the city that would like to help, you know, we're willing to send people to talk about recovery coach, you know, training. You'd be amazed on how many people would probably come out, and especially on the Facebook page with what Patty's doing, you know. And I'd be willing to partner and do anything. I mean, I live at the bottom of Hancock. I'm Malden, but I mean, I'm right over the line. It's all the same. We're facing the same thing. We're facing the same thing. I mean, God, I worked down here in Chelsea Street for 20 years. It's all the same thing. So I think the recovery coach piece is the piece. I don't have the answer, but I think that's a really positive direction to go in for helping these folks. And the other piece that what you guys are doing, that hats off to you, that I'm failing at, is what they suggested at the fentanyl summit is the generation that's in school now. You got to get to the kids. High school, we have a program, and it's too late. Middle school is too late. You got to get them first, second, and third grade. Like, there has to be a health class. There used to be when I was a kid that had the DARE program. There's no funding. That's what we're facing in Malden. There has to be money to put a health class in and add addiction into the health class at a very young age. You don't have to drill the kids with obscene gestures, but drugs are bad. Then the next year a little bit more, the next year, and then by the time they're old enough to have to make that choice, they're going to be armed with information to potentially not make that choice. You know, that's where it has to start. It has to start there, and then the other piece is for the sick and suffering who are still making those poor choices and might not want help. We have to be there for them for when they want help, but we have to stop it where it's starting.
Good. I want to thank you, because like I said, what the information that, because we're always here, like I said, when we developed this thing earlier in the year, or last year, this is, we're educating ourselves as we go along in the process and so forth. So a lot of people like yourself, when they come up here and testify and give us, we're learning too. So it's great to, and what you've presented us tonight is a lot of stuff. I'm sure Ms. Granick and Mr. Vetrano and stuff like that have taken a lot of information now out of this.
Everybody's pens are
Really enlightened me, like I said, because we've always talked about, as Council McLaughlin talked about, how do we follow up with this, because, the clinician can't go out there and follow up with every single person, whatever, like I said, and it can get overwhelming if they're going to administer certain things, so it's very difficult, but having these recovery coaches and having as many of them as possible,
That's
certainly
the key.
The $600, whatever it costs for the program, is well worth it.
And the programs vary. Some of them are cheaper, some of them are, you could
Right.
get it,
But
however you
it's
work it.
But it's certainly a great investment. And I honestly want to sincerely thank you for, you just really enlightened me with a lot of information now tonight.
You're welcome.
That, that we can take back to our colleagues and so forth, and maybe work on some funding for possibly, get some of these people, hopefully reach out to get some people here in Everett to do this, but maybe to work with as a team.
I would love that.
Tri-cities and so forth, to, and work together, and then help with, funding and getting the individuals, down there to train and so forth.
I mean, the list, if we combined, Everett can have a list, Malden can have a list, and that, you just go down, we come up with a name for this program, I always refer to the Angel program, but you guys, everybody knows what that is. We make our own program, and it's not a Malden and Everett thing, it's a life thing. So when these people go out and they have a list of recovery coaches, if somebody wants help, here's a list. Whether it's the person from Everett that goes to Malden or the person in Malden that goes to Everett, what's the difference?
Right.
There's no difference.
Did you have something to add to that?
No, just that, the recovery coach is a great idea, and you'll find that a lot of people in recovery want to do that. But they don't have the $600 to go for
Well,
a week.
that's what we're
And-
talking about from our end, Patty.
Yeah, and a lot of
certainly-
people in recovery love to give back, and that's
Yes.
what they do.
It will work.
And it does,
And
they
I'll
don't do
certainly-
it for the money.
And I know there's only so much grant money out there and everything else, and
Yeah.
everything can't be grants, but certainly if we have, as we know, we have an epidemic going on with this, certainly we have to do our best part here as a city in being responsible, and certainly one of the things is that I think, honestly, it's a very, very minimal cost to get such huge rewards out on the other side. So, and, I certainly would love to bring this, I'm sure Council McKinnon and Council McLaughlin too would love to bring this to the city council and certainly look at possible, funding and bring it to the mayor's office with funding and getting some of these individuals. But I think, we could possibly find it in our budget somewhere to fund these, whether it's 5, 10, 15 people, or whatever it is, but also, I think it would be great to work in conjunction with Malden.
If
and
we could
Medford.
do the fire stations together, like Everett Fire, Malden Fire, and because let's face it, addicts are more apt to walk into a firehouse than a police station. And there's only one police station in the city. We have firehouses in all the wards.
Sure.
Like, there's more, not all the wards, but there's more firehouses available for someone to walk into, because what we're also looking at in Malden is the grade on the hot zones, just probably like you are. We're seeing the lit-up zones with more overdoses than others, and to Patty's point, the people won't be the problem, because someone like myself, I'm 13 years in recovery, and the passion that I have for this, all I have left is to give back, and people like me, there's a ton of me out there.
Yes.
That's all we have left to do, and so we want to help, and we also know what's going on out there. I lived it.
Exactly. Gene, do you want to add
Council-
something?
I just wanna
Councilman,
add-
actually,
She wanted to add something.
yeah, so didn't he.
Oh, I'm
He
sorry.
was first.
I'm sorry.
Thank you, Counselor. Just a quick question, Paul, on the certification, is how long is it for, and is it, do you have to renew it annually?
No, you get it. You just get it. You can take it as far as you want. We're certified, and they'll send you an email every 2 years. Did you just answer the email and you just get recertified? But you can take it further if you want. It's almost unstoppable how far you can go to be.
So for the entry level, when you go and do.
For the certification, it's 35 hours. Yep.
And then the next year they send you the email, is there gonna be an additional fee for that?
No.
Okay. Excellent.
No.
Thank you.
And you said $600 for the program.
That's what it was, $585 for the week, but I've also noticed some were cheaper. So you just keep your eye out and you look, like I'm just giving you what Mystic Valley paid for us. They sent 3 of us for $1,800. I saw the bill, and they were willing to send 3 people from Malden. They had some grant money left, and they sent us, so we jumped on it.
Gene Grant.
I just wanted to add my support for it in that, I think to expect one person to be able to help a whole community or neighboring community. So the more people who are connected to this, because people doing this work need support.
Correct.
Which is actually a good segue to the clinician. I wanted to inquire about what kind of support, clinical and other type of support that this clinician can have in the current job setting, because I'm a little familiar, but I can't speak in any detail, that I know that Cambridge has a clinician, and you mentioned Arlington.
Arlington,
And
yeah,
Arlington has
yeah.
a neuroclinician. And I think for anybody who's been out there trying to help people, and if you don't have the proper support system for yourself.
Gets frustrating.
You can only do so much.
That's right.
So I'm very invested in providing a support, the right support, a good support system, the right support system, which I don't actually know exactly what that would be, but it would be really helpful to talk to other communities that have clinicians in place now.
Thank you.
Our Human Resources, Councilman, our Human Resources Director, they're gonna be doing some research on this to get this up and going.
So we
Maybe,
should
you
talk,
definitely
because
should be
we-
involved with some of the research as well as these program groups
And
that are coming
Revere
up.
has recovery coaches, and even MGH over here in Everett has on staff.
Well, see, that's one of the steps we're just hearing about now. First you get the clinician, then you start with them coming next, and as many as we can get. So if we could do something like that, and then we could work it into possibly the fire or,
Right.
something to that effect.
Mr.
think
Chairman,
that's a
I would
good idea.
ask, I apologize for interrupting, but I would ask then, they just gave us examples of some other towns that, whether it's Cambridge or
Arlington.
Arlington, maybe at our next meeting possibly, if it's, I don't know if it's
Try to get
possible,
them in.
invite the clinician, whoever the clinician is,
Yeah.
and to maybe, so if the HR director and something like that, they can certainly learn a lot more and get a lot more
Sure.
educated. Like I said, we're all here and so forth, because we all want to, get this information so we're all on the same page. So I'd like to have, if possible,
Absolutely.
reach out to the person there and.
Mike, make a motion for that now?
So move
Okay. We're gonna invite Arlington,
in Cambridge if it's
Arlington,
possible.
Cambridge, Revere, is it? With
They
the
said-
It
clinician?
was
Revere
Winthrop.
and Chelsea has it
Winthrop.
too.
And Wakefield, possibly, because Wakefield, I
Well, the thing is
definitely
that,
know.
but to have them all at one night
Yeah.
might be
Too much.
too much. So
Might
if we could maybe teeter
stagger.
it over,
Okay.
over so many months. Right.
What I'll do is I'll reach out, and
Okay.
because I know from police and fire, both,
Okay.
probably 2 or 3 of those communities anyway, and we'll probably bring them all in.
Okay.
We could stagger it.
Right.
We'll just do it that way. So
But I
we'll
do
stagger.
agree with you, Mr. Chairman, is that certainly hire the clinician, but right away, certainly really look at, from what Mr. Hamilton said about, really seriously now looking in and not even exploring, but really implementing, getting individuals that are interested, maybe put some
Oh, yeah.
information out there, and then the sooner we could get them done, the sooner we can get them in to work the clinician as soon as possible, you know what I'm saying? Because, at the end of the day, if we're, in a couple months down the road, we're able to do all this and save a few lives and stuff like that, it would, it's certainly well worth it,
Oh, it's definitely gonna be.
And we
worth it.
could put our fire chiefs in contact.
Absolutely.
as well.
They're already in contact anyway. I think you have a meeting, or you meet once quarterly or monthly or something to that.
Great,
Thank you.
thank you.
Patty Ann Scalise?
And just to note, all the programs that Paul talks about, that there might be 1 or 2 paid staff, the rest is all volunteers. And you'll find that once you're out there, that people do wanna help, so.
Like
I just-
yourself, and like
Yeah, I
yourself.
just wanted to,
Thank
because
you,
you make
Jeannie.
it
You
sound
guys have
like
been
it
doing a
costs
good
all
job,
this
so-
money, but
Yeah, no,
there's
but I mean, even
so
still
many
though, Patty, like,
volunteers.
if we would've said, let's say example in Everett, let's say Everett got 10 people, and, well, let's say we started off on a volunteer basis, certainly, you know, $600, I think is a great, per person, it's only $6,000, I think it's a great investment to work with a clinician.
Yes.
So forth, but down the road, I certainly see that if, you know, like Mr. Hamilton said, if someone decides that they want to go further, of those 10 individuals, and they want to go more and get more educated and get more involved, maybe then that's at that point, then we consider maybe bringing somebody on, you know, at a, whether it's a stipend or a salary or somebody like that, because we know that this particular person's really invaluable, and they've really, you know, really dug deep into it, that they really, you know, that they want to make a huge difference. And maybe at some point,
Councilman,
but I think at some
not to
point-
interrupt,
No.
but just for, you know, an impression on it, what we're talking about tonight is, if we get the clinician, that would probably be the main piece, and then these guys would fall right underneath it. It would be almost like a pyramid, so.
That's right.
And that's how we're doing it actually now. So we're starting, I think, in the right direction, you know what I mean? And these guys here, they're very valuable, because they're the boots on the ground.
Right,
So,
exactly. Gene, do you want to add something else?
Oh, yeah.
I just wanted to actually go back to, you were talking about earlier about getting education in earlier in the school. And I wanted to tell you, if you didn't know already, that there was a grant released last Friday by the AG's office where school departments can apply for it was released to the whole state, so there's a lot of competition. But it's settlement money from from something with CVS. And
That's right.
public school departments can apply for the money. They'll award between $2,500 and $20,000. And next week, I have a meeting with the school people, the school health coordinator, and Mrs. Gassier. They want to implement curriculum within the schools and collaborate. So the AG's office is putting, I would call it, some seed money out there for communities to.
Gene, just for bringing up information on it, is we put in, I think we have 75,000 coming already for, we're just waiting on C9 cuts. It's all being held up right now. Once that's done.
For prevention work or for
Hold on one
treatment?
second. For education.
For
At grade
education,
level
because
3.
you were talking about the clinician, no, the health educator?
This is
Different.
something totally different. So
So
this
the
is something
fifth-
that's gonna be coming in after these two get hired. So
Okay.
we're looking at a third position as well, but that'll be in the school system as well.
Okay, great.
Ms. Bonaro.
Thank you. This question is for you. So that money is going to be offered to communities for educational purposes only, or is it?
As the RFR was released on the 21st, and I've looked at it, and I have a meeting next week, so I'll know a lot more before the meeting.
Thank you for.
But
bringing that up.
it was
Something-
released, and it's on the AG's website. So it's for the entire state.
Mhm.
So, and again, they want evidence-based curriculum and something that would build sustainability, and it's specifically for elementary and middle school, and they want collaborations with community coalitions, with after-school programs. They're looking for not just the school doing it independently, but connecting within the community.
Yeah, that-
Gene, while Gene's discussing that now, why don't you give a little background on yourself? I met you, 13 years ago, probably? I think. It's been that long?
It's been that long. probably.
Yeah, and you've been doing work in the city of Everett for 13 years now, and you work with CHA.
So I work for what's called the Community Health Improvement Department, and CHA has a commitment to work with all the communities to address health disparities, and substance abuse is one of the issues that arose early on in CHA's connection with Everett. And so over the years, there were some federal grants that were available to Everett for prevention efforts. And I've worked closely with the schools to administer the Youth Risk Behavior Survey, which has provided data since 2000. And 2002, 2003, and it may be hard to believe, but from the data from 2003 to the present day, every substance has gone down for between 6th and 12th graders, and marijuana has gone up very, like a couple percentage. But between 6th and 12th grade, the survey, excuse me, it's not a test, it's an anonymous survey that's given every 2 years. And the data is used to help acquire other grants in the cities. And it's used across, the data is used across the country. So while this situation is going on, alcohol rates have gone down, binge drinking, tobacco use by youth.
What's the group that you have after school, teaser?
That was a group that I started
Okay.
about many years ago, and now Jamie Lederer oversees it. And they're a group of high school students who work on policy issues and education to their peers and raise awareness around substance abuse issues.
Good program.
And they've worked with the health department around some of the changes in tobacco, and they keep coming back.
Yeah, sure.
And many of the youth have gone on to graduate school in health careers, and we keep writing recommendations for them. So.
Awesome.
Valerie, want to add some more?
Yes, thank you. That data that you speak of, does the community have to obtain such data for the release of any monies to the district? Do they require data, like you?
Well, if you're going to apply for a grant, they usually want to know some data about your community,
Okay.
What your rates are. So you could say, we have a problem, we believe, we have a problem, but they want to know what your admission rates are. So, or what your youth use rates are.
Right.
Or perception of use, perception of what their parents believe. So so they're standardized.
So it's something you're doing, going into the schools, getting the data.
Right. So in
We just hired someone in
in
Malden
Malden-
3 months ago, and that's exactly what they're gonna be doing, but we won't have the numbers for
But
2
you
years.
actually do, because actually, and then the other thing that we
Is
do.
that is that released readily available, or
Which
the
one?
data?
Youth Risk Behavior
Yeah.
Survey? Yes, it's on the CHA website, it's the school, everyone, the
What
the
I'm
data
asking is,
public.
in reference to Malden, he's saying that they just
Oh.
hired someone now.
We did just hire someone, yeah.
Okay.
But Renee Camerado?
I know, yeah.
Yeah, I know you
Yeah,
know Renee.
yeah, oh, yeah.
So she worked with the school.
I'll see Renee offline,
She
yeah,
did, but
absolutely.
Malden has Youth Risk Behavior Survey. It was done last year, and then.
And I will get that
the
tomorrow.
well-being of
The
Malden.
book she just put
The
up.
book
That's right.
uses that data.
That's right.
So-
Okay,
So there's a lot of data, and even if your rates are going down, it doesn't mean you're not qualified to get the grant money. 'Cause
Sure.
There's other risk and protective factors that need to be addressed, or resources in the communities.
What other grants are available, Gene? Do you have any, because I put it in the letterhead to
I don't
ask
know,
about
I
granting.
actually had some questions about that. So the grants, people find out about grants in various ways. I'm on a lot of email lists, but most of the grants that I find out are prevention focused.
Mhm.
They're not treatment. They're not, I get recovery coach information. We're on listservs. There's many listservs you could get on, anybody could get on, that would find out what training is available
Sure.
locally in the state. So I know that there was the Cambridge Health Alliance with Senator Salvi Domenico received some funding for additional outpatient office-based treatment
Yep.
for Suboxone, and we're waiting on that. There may be some 9C cuts, so
That's, everybody's money's frozen right now.
everybody's money.
I actually had conversation with the governor's office today, and I am awaiting a call back tomorrow to see where and if they're going to anticipate that being cut. If not, they may, at some point, release some of the funds, so there'll
But
be.
I think, I just want to say, prevention is challenging because you don't see results right away. It's a long-term process.
Sure.
So.
I get it. We get it as a
But if we don't
committee.
invest in prevention, as everybody's been saying,
Stigma, no stigma, you know, we've been doing an informational thing all over the city. We've done that. That's old hat now. Now we're starting to get into like the clinician aspect of it, the programs aspect of it, the boots on the ground aspect of it now. So, and we're trying to get into, you know, if we can get the chiefs, which are both supportive, involved with that, I think we can do some very, very good things here. But I'd like to just clean something up with Paul.
Mhm.
Paul, we had pediatricians that came in. There was one that came in, but I interviewed 9.
Mhm.
And what they came back with results was there's a neonatal study that they're doing now, and Senator Markey is asking for $600 million to $1 billion right now in funding. The information that they actually gained from some of these hearings that we're doing now, they're going to be using that information at the Washington level.
Awesome.
So the information that we had at our last meeting was with one of the pediatricians that's here. He was supposed to be here tonight, but I believe he had another commitment to go to, but we'll get the facts and figures from him. The fact of the matter was for every 10 patients that he sees, 7 to 8 of them go to neonatal at upwards probably to 66,000. That's what I got from Markey's office to cost factor per month. So that means when the infant is born into the world, it's addicted, and they have to go and be weeded off different drugs that they're addicted to at the neonatal site. So there's a cost factor to that as well, and they're looking at that. They're doing major studies on it now.
Can
So
I
that's
just
why-
add to that? Tough one.
That's, just to clean it up a little bit more, is that's why we're looking at grade level 3.
And I really appreciate you just saying that, and this is why I'm such an advocate for the youth. So a year and a half ago, my grandson was born addicted to fentanyl and heroin. Both my daughters right now to this day are missing. They're both shooting dope. My grandkids are in foster care. I'm fighting DCF, so I really appreciate what you just told me, because that's there's a big problem with the kids being born, like the whole thing, and I'm right in it.
Sure.
Like I'm in all of it. Like every time my phone rings, when it's a different number, I don't know if that's the call. So.
Yeah.
To what you just said, I appreciate you telling me that, because that's hopeful news. But this stuff is real, gentlemen.
Oh.
It's happened to affect me personally very hard, and I hope it doesn't affect everyone the same. But like it's, you know, we have to fight.
Oh, in
Yeah.
regards to that, my nephew passed away. That's why I met Gene Grennett
Mhm.
back in 13 years ago. That's when he passed.
Yeah.
Actually, it was 15 now. So I met you 2 years after. And he died of an overdose. Started with Percocet, and then it went to Oxy, then it went to heroin.
And
he
yeah.
lost that battle. I know that Ms. Scalise has individuals in her family
Mhm.
member. If she wanted to share that, she should. But, you know, she had individuals in her family as well. So there's a number of people that were affected by this.
Have there been any statistics yet of the children who are born addicted to heroin on what happens to them? Like, what is the ratio? Like, I haven't heard that yet.
We're waiting. Right
So that
now.
hasn't, that hasn't come out yet. I'll be curious to see that, because, you know, it's really sad when you're born, like you're born addicted, right out of the gate. Right out of the gate, like you're.
That's why
Yeah.
when we're looking at grade level 3,
Yeah.
my theory, but it's not my theory, it's taken from LA, Los Angeles, New York City, New York,
Yeah.
where they're having real problems as well. What they're doing now is they're looking at that and they're saying that, well, if we can start teaching at grade level 3, maybe this generation will have a chance to actually
Yeah.
go on in life without, you know, dabbling into what they shouldn't be dabbling into,
Well,
per se.
Anything that Everett is involved in any way that I can help from my position, I would be more than willing to come to a meeting. I would partner with you guys. Like, I'm trying to pull us all together as one, so just know that, like, I'm here in a heartbeat if
I
ever
seen you
called.
at
I'm here.
Angel, were you at Angel
That's right.
Baseball?
Yeah.
That's
Okay.
right.
All right, so I seen you at Angel
Yeah.
Baseball, that's another good program.
Yeah.
Sports program, gentlemen, it's in Malden, it's a baseball program, and ladies. What they do is they have the kids pledge that they will not do drugs. And then they basically, they're right on them. And it's kind of intense what Julio does over
That's
there.
right.
He does a great program.
But these kids have a great success rate.
I know Shannon Brandano,
Yeah.
she was involved
Yeah.
heavily with it. So, that's enough being said about
I
that.
just want to invite all you guys, personal privilege right here real quick, that December 1st, has anyone heard of Generation Found? This goes for the audience as well. It's a movie that came out in 2016 from the people who made The Anonymous People. It's dedicated to what one town has done to combat the opioid problem. It was a town in Houston that was hit so hard with this issue, and it's a feel-good story of what one town, how they came together to fight. And you have to buy the movie, and you have to have a screening. So we have partnered with the city of Revere. Revere has paid for the movie, and we're hosting it. They didn't have the spot to host it. We're going to host the movie in the Jenkins Auditorium December 1st at 7 o'clock, and I urge everyone, and this is for kids, this is for teenagers, this is for adults. I urge everyone to go on our site and just register. It's free on our Facebook page. It's if you go on our Malden Overcoming Addictions Facebook page, you will see it. It's a free thing, but you have to register online. And kids, adults, all communities, please come to Malden on December 1st at 7 o'clock. We're going to have all the resource tables there.
Where is the Jenkins, just so
It's
people?
in Malden High School, 77 Salem
It's right
Street,
in
right in the
Malden.
front steps. It's going to be a really special night. So-
Speaking of that, we had a director here in the chambers one night. That filming that they're doing, he went statewide, and what he did was he covered a meeting that we had here as well, and the president was involved with that as well, so Mr. Hanlon was here. But all the groups were here. I think I invited you, and you had
I got sick.
yeah, you had
I was
something.
telling Catherine on the way here, I was invited here and I got
That-
sick, I couldn't come.
I think it's 9 months in production, and then another 9 months to come out with a finished project. So, probably September
Okay.
of next year, but when it does come out, he's looking at putting it, first, he's gonna go statewide, mass, and it's gonna be at every health department. Then what he's going to do is, he's gonna take that, and it's probably gonna end up going national at some point. So, once it goes national, it's very, very interesting topics, and we'll say, that and people and individuals that he's actually interviewed. So, glad to be a part of that.
I would love to have you guys there. I mean, I'll just say, I'll end with this, like, more people, more brains on the same subject, the better result. And like, the more of us we put in the same room on this topic, like, we're gonna come up with some real good ideas.
Well, what we're doing now is, while we're coming up with these good ideas, it's being aired live, so this is going out probably to, 60,000 people? So, whoever's watching tonight, and it will be re-aired and re-aired. and
Perfect.
re-aired. So, all the comments are being looked at live right now, so.
And thank you for having us.
Chairman, I would like, also, like, as we talked earlier, I mentioned having, if it's possible, at least one or two of the, the clinicians from the other cities available, but I'd also like to invite back, any of the panel that's here tonight, the chief, the captain, and so forth, and Mr. Spinney, or anybody that's up here also now, would like to come back and maybe have a nice, roundtable discussion, at our next meeting, whenever it's possible to schedule it,
Make a
So we-
motion.
So again, we're learning ourselves our own of it, but we have Malden here and so forth, and if we're gonna, work as a team and stuff like that, we wanna be able to share information, so if somebody's from Arlington or Cambridge comes in, is able to educate not only us, but them also too on certain things. Like, Mr. Hambles, you just said, the more heads we have in it, the better we're gonna do, and so we can get us all on the same page, so I'd like to, invite them for the next thing,
In November.
please.
Next meeting will be in November. We don't have a date yet, we'll get one.
Okay.
And then, what we'll do is we'll re-invite all the individuals that are here tonight, to do a roundtable,
Right.
and I'll be the chair, so we'll just pick who's gonna talk first and stuff like that, but, and then we'll try to get Arlington, Wakefield maybe, to talk on clinicians and how they're utilized. The structure that and I talked to Rick Smith, so I'll give a little insight on it. The structure that we have with the clinician is, they end up, and the only reason they are with the police over there is because fire had an issue with it. That's the only reason. So that's why they're with the police, but he loves the clinician. He does. He absolutely, he praises the clinician, you know, it's like the best thing since God, you know? So Ricky Smith's a very good guy, and he means well, and he's adamant about this. And he said that for 7 years, that's been the best thing that he's had over there. So clinician's probably one of the top dogs besides the program director that we're probably putting into play sooner than later. I'd like also, Mike, if you could just have the city solicitor check into that regarding HIPAA as well, just so that we can move forward with it. I want that all set. So those two will probably be in play. I think, what did the mayor say, Monday? That we're looking. So probably Monday, we're gonna be looking around, and then we're gonna come up with some information on it to actually do some research. The other thing is, why don't we make a motion too to see if we can get funding at some point for the boots on the ground?
So then, yes, so what I would like to do, Mr. Chairman, is make a motion that for this committee that we send it out to our general meeting, council meeting, asking for,
Funds.
for funding for, recovery coaches, whatever that number is, depending on, what can we afford and so forth, but at least,
How many do you have in mind?
We have 5, and so my thinking was, again, when they said there was 168 hours in the week, so now you have to break that down. You have to come up with a formula, and I haven't. $600 per person. So I was thinking a number that came into my head, if there was 40 or 50 people, even anywhere in between 30 and 50 people, we could make this work. Because obviously everyone has a life, it's volunteer work, everyone has to go to a regular job.
Sure.
So if we could have increments of 2 and 3 hour windows where you would say, I will be available from 12 to 3 on Friday, no matter what, so then you know from 12 to 3 your phone could ring. But it's imperative that you answer that call, whether you get called or not, because then the thing will implode.
I got a quick question on that. Would Malden be involved with putting more people on?
Yeah, I'm working on that now, and again, like I said,
What's the mayor say over at Christensen? What's he?
he is just
He's on
backing me like you would. That's why I'm here. Like
was at Angel
he's
Baseball. I
amazing.
seen him
He's
talk.
amazing.
Yeah.
He's on board 100%. And again, in about my paperwork's already in. I'm waiting for it to come back. The second it comes back by Christmas, I'll be a nonprofit. So then we'll be able to take money and get grants. Once I do that, then I'm gonna just push all that stuff. It's gonna go 100%. I'm going hard with it.
So would for the sake of this right now, would he be interested in possibly looking at maybe a joint venture here?
I will bring that to him. I'll even talk to our council. I film our council meetings, so I can, I'll see if I can bring this up with our council.
Okay.
So, Mr. Hammersley, let's say, like, we started off and we're looking for funding and, starting this up in a couple of weeks.
How many, Mike?
Just to start off, would you recommend, I think it would be tough to take 30 or 40 people at once, whatever.
That's right.
But would you recommend like 5 or 10 people?
If we could do 5 or 10 people, like each one of us, you do 7 or I do 7, or we come up with a number. Let's just say we said 10. If ever could get 10 and Malden can get 10.
I was thinking 10.
Okay, if we could each come up with 10, and then like I could work with, everything's online nowadays, we can come up with like some wording and we put out there, listen guys, we're meeting this specific night, come on down, this is what it's about. We put out an agenda on a meeting, what we're looking for. See how many people come, because I've got 10 people that have approached me already saying, how can I help? Because we just did a vigil and I challenged the city. I called them all out. I said, because like we had no recovery coaches last year, now we have 5. I said, I'd like to see 25 next year.
Sure. Like,
I'm challenging you. Here it is. Here's the call to action. We need people. And so many people said, how can I help? So that,
Counselor, well, Patty, what
Patty, I was gonna ask.
what do you think for numbers that you can
I'd
get?
like to see 10.
10 would be
Start
great.
off with 10.
Now, do you have anybody I mean, certainly we'll put it out there, Patty, but would there be anybody that you could recommend that would be, responsible people that you think that, would go through the
Oh,
program?
absolutely. Yeah, I
Okay.
worked with a lot of people in the recovery world.
And to give you
Like I
an,
said, they want to give back, but a lot of people in recovery don't
Have
have
the funds to do it.
$600.
No, that's good.
You know?
So I think that's great. So, Mr. Chairman, I would recommend then that we look at 10 people.
phone in.
So we're looking at funding for possibly maybe $6,000-$7,000 to send those people and, whoever those individuals may be. And so I would make that recommendation that we send it out to our next
Motion,
motion, on the formal
motion,
motion, to our next council meeting, looking for funding, and we can, like I said, come and, explain it more at that particular meeting, but basically
sure.
what it's gonna be.
You want that
for.
going general?
Yes.
Okay. Motion made and seconded to send this to general meeting for recommendation.
Why? No, but I'm saying is that, but we can make a resolution
And then send it.
asking, and then the mayor, we can send it from the mayor's office. on
Yeah,
there.
well, it'll come from the body first and then go to the mayor.
Right.
To go to the mayor, okay.
Correct.
Just to give you an idea, if you were to go to MaldenOvercomingAddiction.com, we have a page dedicated to the 5 recovery coaches. So when you click on it, there's the pictures of each person, their phone number, and that we're about to put on. I just got the clearance yesterday to add that to the city website's resource page,
Sure.
because this is what was part of the meeting. But just to give you an idea of what it looks like, on MaldenOvercomingAddiction.com, on the recovery coach page, there is our mug is right there, who we are, what we're about, our phone number. So the person, if anyone is looking at our website, they see we have recovery coaches, and you can call 24/7.
Like I said, I just
Let me
wanna
finish
thank
the
them.
motion, hold.
No,
All right,
sorry.
So the motion would be to, send the resolutions down to the general, and then requesting it to go to the mayor's office.
Correct.
That would be the end result. For funding of recovery coaches, up to 10 at $600 per,
Yes,
and a total of 6,000,
correct.
starting off initially.
Yes.
All those in favor?
I,
All those opposed? The ayes have it.
Chairman, I just want to thank all our individuals for coming here today. I think I said it right. I mean, I learned so much, and this is what's great. I'm so honored when the president put me on this committee, and like I said, it's been very rewarding, and certainly it's, this is really, to me, it's the most rewarding committee to be on in the city. I'm really, really, really honored to be on here, like I said, but just, I got a real education tonight, so I want to thank all the individuals that were here tonight.
Thank you.
Thank you. Councilman McLaughlin.
Mr. Chairman, I would also like to echo the comments that Councilman Mangan just made, right? So I've sat here quietly this evening, which is not typical of me, but it's because I've been learning, and I've been listening. And I've actually taken about 4 pages of notes.
Oh, boy.
Mr. Hamsley, I've known you for a long time, right?
You have.
And we've talked about this issue many times off the record, but to hear you talk tonight is truly a testament for you and your character and your strength of who you are as a person.
Thank you.
And I applaud you for what you do every day for the city of Malden and the
Thank
fact
you.
that you're reaching your hand out to the city of Everett and saying, let's become partners. I can't be more happy to accept the offer and work together
Yeah.
to make that happen. Mr. Bernard, I want to thank you for also coming to the city tonight as a member of the school committee. I know that you guys are dealing with this issue in Malden, and I know that you guys take this very serious as well. And I applaud you for coming here tonight and giving up your night to be a part of this. And thank you for coming. And to the 2 ladies that are sitting in front of me, you guys do amazing stuff every day in our community. I watch Patty Ann's Facebook page every morning to see the beds that are available and how we can help kids and individuals in our community, and just keep doing what you guys do, because you're amazing, both of you, to our city. Just really a life lesson was learned tonight in hearing all of what is out there. It's truly eye-opening, right? And you have to kind of take it all home with you and digest it and kind of figure out where you really go and how you move forward. But I think that we have a team in place that is going to be an unbelievable team to work together for not just Everett, but for the region. So I'm really happy to also be a part of this group. Thank you for all coming tonight.
Awesome.
Patty Ann Scalise.
All right, so I'm gonna be the pain here. You guys know my story. My nephew died last year of an overdose. He was 17. My son actually just got sectioned Friday, and the Everett Police Department was amazing. He is now at Bridgewater State Hospital, where he's safe. And I'm gonna be the bad guy here, and with that job, the first one, the one that I just gave you,
Program.
program, that went out in the city's website in March to get filled. Why it wasn't filled and why it's now off the city website, I don't know. Like, and now you're saying it's back on. That's a $450,000 grant. That went out in March, and that's not filled yet. Why? I don't understand it.
Well, I'll answer some of that, and then, tonight, we seen the mayor, and we had a conversation with him, and I mentioned that as well, and he said, fill it Monday.
Why wasn't it filled in March?
I don't know. We're
Like,
gonna
how
have to
did that
ask the
slip
mayor,
through the
but,
crack? That's $450,000. That could have been started in
actually,
April and May.
absolutely.
And we're now going into November, and we're gonna send it out there again? I don't understand. I'm
Director?
sorry, I don't wanna sound like the bad guy and the one always coming back, but.
No,
It's an opportunity for us to improve if that's actually the case, so I appreciate you bringing that to our attention. As the HR director, I've been in the role a short period of time, since January. However, I do not recall that being on the website, and if it was and why it was removed, that's news to me, I'm learning this evening. But I will tell you that it's utmost priority of the board and through the mayor's office under Mayor DiMaria. He's a big proponent to push this stuff forward, and this will be on the website and in the job board, bulletin boards, by Monday, I promise you that. So I'm not sure, there was another coordinator on there, and I also know that through our office, we posted some coordinators for Suffolk and for the WIN programs through the unions. So I don't know if something got posted that might have been commingled. I don't do the postings, it goes through our website, but
I can certainly send you the link, because I got it off of MMA on March 28th. It was sent to me from City Hall to look on the MMA website for job postings for municipal jobs, and that was on there, and I actually printed that out. That was the job description that HR put out, the health department.
okay, well.
I mean, I don't wanna sound like the bad
No,
guy
it's an
here and come
opportunity for us
back
to
at you,
improve.
but.
Absolutely, and
We're all, put it this way, we're all here to
Yeah.
hear what we should be doing right.
Yeah.
So if we can correct something that we did wrong, or maybe mishandled at some point.
No, I'm not saying it's
We're
wrong,
here to
but
do
it
that
was a
now.
job posting in March, never failed, taken off, and now it's back on. Those are months of.
We don't
what
have the
they've
answer
been
to that.
doing.
Absolutely. And again, I don't recall seeing it there, we didn't post anything, but I'm happy to talk with you after the meeting and get better at doing that if that was the case. But, sorry to learn that this evening, if that was it.
Anything else? Actually, I have Mr. Spinney out in the audience there, which gave testimony. I gave the chief, Mr. O'Brien left, and Mr. Lattarelli from Everett Overcoming Addiction. Come up, come on up. All of yous, come on up. Just come on up. Chief, Mr. Spinney, before we leave. If you have anything, just let me know and I'll call you in. Just please state your name and what organization you're with.
Anthony Lattarelli, Everett Overcoming Addiction.
Chief Carley, Everett Fire Department.
Thank you.
Tim Spinney.
Ms. Lattarelli.
Yeah, my question is on the recovery coach training. Is there an option to send somebody for a train-the-trainer program?
For what?
Train-the-trainer, where you could go,
T for T.
take a course to become a certified trainer, and then in turn, train groups of people?
Yes.
And you know what
Is-
the cost of that is?
Is that after?
Yep, and
Okay.
that, awesome point. So what could happen is, but you have to go the distance.
Mhm.
You would have to go the distance and do the 18 months and become, legally certified. I don't know the terminology, but yes, and then that person could train everybody in the city. So
T for
then you
T,
wouldn't
that's
have
what
to
they
go.
call them. We used
But
to use
yes,
them in the
but
state.
The one person would have to go the distance, and that is, more money, obviously, but yes.
18 months, maybe?
I think it's up to 18 months, but to your point, yes, that can be done, 100%, so you can look into that.
Because that could end up, it'd be a larger initial cost, but could save all the cities tons of money in the long run.
And then that
For having their
particular
own
person
T
that
for
would be
T.
doing that would be also collecting hours as he's training, and then he's paid for that, because that's what happens when you go to that level. You become paid from the state, and you're hooked booked in with hospitals, and everybody's calling you, and they pay as much as $30 to $35 an hour. And it becomes a full-time position, but yes, that's 100% correct.
But the initial would be the recovery.
The certified recovery coaches is imperative. Like,
Okay.
you do that right away. It's 1 week. The person has to go for a week. We traveled back and forth. It's 8 to 4, Monday through Friday. You're home at night, you go back in the morning, and it's done, and they're 8-hour days.
Could you do us a favor,
Yep.
Mr. Hamsley? We have recovery coach, what's the next step, and then the next step, and then the next step, and then T for T? You know what I mean?
After
So
recovery coach is suggested?
Absolutely. So,
After recovery coach,
you don't have to give it to us now.
Okay.
But if you could just break it down to see what, maybe some individuals would want to be T for T trainers, you know what I mean? And then we could actually put
It's
them
not
on,
called
look for
training, it's
funding.
something else, but yes, to your point, that 100% can be done.
Okay. Thank you. Anyone? Excuse the customary thanks. Thank you for all appearing tonight. I want to actually, thank you all for appearing. Thank Malden for coming. You wanted to bring something back to the school systems of Malden, you can certainly bring some of this stuff back now. So if your meetings are any time, let us know, and we can, as a committee, come over and we could testify before them. So you just let us know, all right? If you need us, if you need something, if you need something over there, you just call us here or get in touch. The members are always available. I'm available. You can call our secretary, Mr. Burley. Whatever. Clerk of committees. I'm sorry. Secretary. Well, that's what it was starting off to be. Wait a minute, we need a secretary. Thanks, Johnny. But thank you all. Motion to adjourn. You have adjourned. Thank you.
What's that?
Mikey.